Hello students, this is Dr. Deptee Warikoo, Department of Physiotherapy, Dolphin PG Institute of Biomedical and Natural Sciences. Our today's topic is posture. As we all know, good posture is about more than standing up straight so that you can look at your best, but it is more about a good long-term health. Making sure that you hold your body the right way, whether you are moving or still, can prevent various pains, injuries, and other health problems. So, let us start off knowing what is posture. It is very important for us to know first that what is posture. So, if we see the definition, posture is the position or attitude of body or the relative arrangement of the body parts for a specific activity or a characteristic manner of bearing one's body. It is defined as the attitude assumed by the body either with support during the course of muscular activity or as a result of the coordinated action performed by a group of muscles working to maintain the stability, according to Dina Gardner. So, when we talk about the posture, we say it could be active or inactive posture. Inactive posture, excuse me, students. Inactive posture is the posture where we are talking about mainly at the rest and sleeping. At that time, all the essential muscle activity will whatever we require maintains to maintain our life remains minimum. And active posture is when there is action, when we are doing any activity. Active posture could be dynamic or static. Dynamic posture is how you hold yourself when you are moving, like when you are walking, running. Here, the muscles and non contractile structures have to work to adapt to changing circumstances. Static posture is how you hold yourself when you are not moving, like when you are sitting, standing. Here, the body segments are aligned and maintained in a fixed position. This is usually achieved by coordination and interaction of various muscle groups which are working statically to counteract gravity and other forces which are acting on our body. So, static posture you can see when we are standing, lying, or kneeling. When the body, then the muscles are mainly to acting mainly to stabilize the body. Dynamic posture is when the body segments are at movement like running, jumping, throwing. Now, what is ideal posture? Ideal posture is when the posture is at its best. Like you can see in the figure, we can see the first posture is the poor posture, when you can see the patient is not lying straight, standing straight. Third one is also a poor one. But the middle one is the ideal or the good posture, where if we see laterally, we see the vertical line, that is line of gravity, passes through these particular points. At the head, it lies through the earlobes. At the shoulder tip of the acromion process, you can see in the diagram. At the thoracic level, anterior to the vertebral bodies. Lumbar level through the vertebral bodies. Hip through greater trochanter. Knee slightly posterior to the patella. Ankle slightly anterior to the lateral malleolus with ankle in neutral position. So if line of gravity lies over these positions, we could say that the patient is having an ideal posture. Sitting posture is ideal when there is great deal of stress on the intervertebral discs, and that is maintained by a proper curvature of the body. While we are sitting, there is great pressure when you lean forward. The lumbar curve is decreased and pressure increases. Increased and sustained muscle contraction is required here to keep the body in an upright and idle posture. As we all know, human is a bipedal animal, so we walk erectly. When we are erect, we walk on both the foot, that is the bipedal stance we have. There is advantage of these bipedal stances as well as disadvantage. So advantage is that it gives freedom for the upper extremities to work simultaneously, and disadvantage is that it increases the work of heart on the work of vertebral column, the work of pelvis, the work of lower extremities, and also When we are bipedal, there is one more, you can say, the disadvantage, that is we have a decreased disability. There are some things which are very important and working very importantly on our posture and balance. The first thing is base of support. Base of support is the area bound posterior by the tip of the heels and anterior by the line joining the tip of the toes. If the base of support is increased, the balance is more. If the base of support is decreased, we have a least balance. Then one more thing which acts very importantly is center of gravity. Body, it is the body's balance point. And this is the point where there is concentration of all body weight. The location of the center of gravity of body is fixed but may change as you age. Like in children, we see it in the 12th vertebra, the 12th thoracic vertebra. The adult, we see its second sacral vertebra. While we are sitting, we see it above the seat and near the armpit. So, COG in humans varies with body build, age, gender, and it also has a very good and important effect on your postural sway. Now, posture is related to the curves that we see in our vertebra or the spine. The position of your body parts in relation to each other vertebral alignment is very important, because here we counterbalance the anterior posterior curves, which are very important because they act as shock absorber. If we do not do it, the risk of injury will be increased. Then we have postural sway. As the child is born, he has the primary curve, that is the kyphotic curve. As he starts to have head control, the secondary curve, lordotic cervical curve, starts to develop. As he stands, the second secondary curve, the lordotic lumbar curve, also starts to develop. So these secondary curves develop with weight bearing. There is also very important aspect which plays role on posture, that is the pelvic position. It should remain neutral, that is the ASIS and PSIS should always remain leveled in the transverse plane. That we have to make sure that we are seeing while we are analyzing the posture. Now, the postural control. Minimum amount of muscular activity required to maintain stable erect posture is very important to maintain postural control. Postural control is a complex phenomena when we are talking about either static or dynamic postural control. It is a very complex phenomena which needs the skills of your CNS and the other biochemical and biomechanical elements, that is the sensory elements and the vestibular elements, the visual elements, which play a very vital role in maintaining the postural control. Here we say two types of basic controls. One is the reactive control, another is the proactive control. The reactive control is a compensatory control. These responses, the reactive responses, occur as reactions to external forces that displace the body's center of gravity. When we talk about proactive control, that is the anticipatory control, these responses occur in anticipation of internally generated destabilizing forces. Like while we raise the arm, we bend forward, like that, the proactive responses are there. So, the main role or the main goal of the posture is to control the body's orientation in space, maintain the COG over BOS. This is very, very important, which we have to make sure. So, we have to make sure that all the segments, that is the visual, vestibular, nervous, and muscular segments, are coordinated to make sure that mechanism of posture is proper. So, what is this mechanism? Postural mechanism, as you can see here in the diagram, is basically how we see how our computer works. So, as our computer works, we have the inputs that is given by the receptor organs like eyes, ears, muscles, joints. Then we have our main CPU, that is the cerebral cortex, cerebellum, red nucleus, vestibular nucleus, which what they do, they coordinate the response we have to make, and what stimulus we are getting. Then the response is given by the effector organs, that is mainly the muscles. So we here what is very important are the muscle synergies. These combinations of muscle works are there to complete a task that is given to the system. So central nervous system functions to choose most effective combinations that could be performed by the muscles. Here proprioceptors play very important role because they will help the CNS to choose the right action. And the vestibular system governs overall force. Then there are perturbations. These are the sudden change in conditions that displaces body positions away from the equilibrium. So we can have sensory perturbations, mechanical perturbations. Sensory perturbations are mainly by altering the visual cues, and mechanical perturbations are by change in relationship of COG and BOS. Here we can give some external perturbations with external stimuli also, which we can give as as a therapist to the patient. Now, what are the role of the muscles? What is the basic role of the muscles? The intensity and distribution of muscle work required for both static and dynamic postures is very important. It varies with the pattern of the posture and physical characteristics. We have two types of muscles, phasic and postural muscles, tonic muscles. The group of muscles which mainly employed here to maintain the posture are the tonic muscles, the postural muscles. They act by working to counteract the effect of gravity. Therefore, we also call them as anti-gravity muscles. They are multipinnate in nature and fan-shaped in nature, and mainly they comprise of red fibers, which has capability of sustaining contraction and having least fatigue due to low metabolic rate of action. There is relatively small amount of muscular activity which is required to maintain a stable erect posture, but these postural muscles are the main muscles to play the vital role. Second important thing is the nervous control. Neuromuscular coordination helps in maintaining posture by innervating the appropriate muscles for the complex reflex mechanism. Now, postural reflex has a primary importance in maintaining posture. We all know that. We have read that earlier also. It can be defined as an efferent response to an afferent stimuli. The efferent response is what we are getting by the motor response, and the efferent stimuli is from the muscles, the eyes, the ears, the joint structures, the skin sensations. Mainly while we are talking about the posture, it is mainly from the sole of the foot. Responses can be, as I already told you, two type of responses we will have: reactive and proactive. Reactive is the compensatory response by external forces, and proactive is the anticipatory, that is due to the action of internal forces. Absent or altered input and output can cause difficulty in postural control, and it mainly occurs if there is any injury, or the muscles are going through atrophy, or there is any sensory and mechanical perturbations. So muscle synergies, basically there is a normal functioning of CNS, which as I already told you, selects the response, and very importantly, which play the systems which play role are proprioceptor system and the vestibular system. I am again and again talking about the perturbations. These are the sudden changes. As I told you, they could be sensory perturbations or the mechanical perturbations. Now, there is one more thing, that are the synergies or the strategies. The postural responses or the involuntary reaction to perturbations are referred as the synergy or strategy. There are mainly these types of synergies which we could see. First is the fixed support synergy. Second is the change in support strategies or synergies. And third is the head stabilizing strategies. The fixed support strategies are mainly taken with the help of ankle and hip flexions. Change in support strategy is when you get the perturbation, you just try to step forward or grasp anything. Head control stabilization is with the help of head. So fixed support synergies or the fixed support strategies. First, the ankle synergy, and second is the hip synergy. The ankle synergy consists of discrete bursts of muscle activity on either the anterior or posterior aspects of the body. This occur in a distal to proximal pattern, and as we see these ankle strategies, they are due to response to forward and backward movements of the support platform. Same way, the hip synergy consists of discrete bursts of muscle activity on the side of the body opposite to the ankle pattern in a proximo distal pattern. Okay, that is distal proximal, the ankle strategy, but the hip strategy is distal to proximal pattern. Now here you could see the ankle strategies. The you could see the perturbation, forward translation of the support surface, and backward translation. So you could give a forward or backward translation. So how it will work, the muscles, tibialis anterior, quadriceps femoris, and abdominals, and mainly the neck flexors will work. And in the backward translation, gastrocnemius, hamstrings, and paraspinals. Same way, when we are talking about the hip strategies, if the perturbation is forward translation of the support surface, the response will be given by abdominals, quadriceps femoris, and tibialis anterior. If there is backward translation of the support surface, the response is given by paraspinals, hamstrings, and gastrocnemius. Here you could see the strategies in response. See the base of support, which is constant, and how the center of gravity or center of mass moves in the perturbations and responses. See, this is the stepping forward strategy. Here in this diagram, you could see the stepping forward strategy. Now let us talk about the kinetics and kinematics of postural control. So there are forces working on our body which constantly keep on working. There are external forces and the internal forces. External forces are mainly inertia, gravity, and ground reaction forces. Internal forces are produced by the tension generated in the muscles, passive tension of the ligaments, and the soft tissue structures. So postural sway plays a very important role here for the forces. It occurs in a static erect standing posture or can say forms sway envelope. So there are 12 degrees in sagittal plane, 16 degrees in frontal plane. These sway shifts the line of gravity constantly, but mainly not considered in analysis of force and static posture. Here we will discuss about the ground reaction forces. The ground reaction forces are basically the forces which is the reaction of the ground to our body's force on it. Whenever the body contacts the ground pushes back the body. This force is known as ground reaction force, and the vector representing it is known as GRFV, that is ground reaction force vector. The ground reaction force is a composite force that represents the magnitude and direction of loading applied on both the feet. The vector and the line of gravity has coincident action lines in the static erect posture. The ground reaction force is a more common name for the force of ground on person. In equilibrium during static stance, we would expect the force of gravity on person to be equal in magnitude and opposite in direction to the ground reaction force represented by the GRFV, that is the ground reaction force vector. Now there are some coincident lines also. These are the action lines. The coincident action lines formed by the ground reaction force vector and the line of gravity serve as a reference to the analysis of the effects of these forces on the body. So whenever we are talking about the analysis of posture, we do analyze these coincident actions line and the ground reaction force vectors. Now let us have a look at the analysis of posture. So first we will see the alignment of posture in the sagittal plane. While we are talking about the sagittal plane, The first joint we will discuss is the atlanto-occipital joint, where the line of gravity passes anterior to transverse axis for flexion and extension. The external moment is flexion, and the passive opposing forces are by ligamentum nuchae and the LR ligament mainly, and then the atlanto-occipital membranes. The active opposing forces are rectus capitis posterior major and minor, spinalis capitis cervicis, spinalis capitis cervicis, and inferior and superior oblique muscles. At the cervical level, it lies posteriorly. We will see it lies posteriorly. Opposing forces are anterior scalene, longus capitis, and coli. We can see the same things in active opposing forces and passive opposing forces. In the thoracic level, the line lies anteriorly. The passive opposing forces are posterior longitudinal supraspinatus and interspinalis ligaments, and the active are ligamentous flavum, longissimus thoracis, iliocostalis thoracis, spinalis thoracis, and spinalis thoracis. These are the basic forces. You could see the cervical and the atlanto-occipital have the same forces act. Now we will be talking about. Next, we will see the hip joint, where the joint line of gravity lies over posteriorly. The external movement is extension, and passive opposing forces lie over iliofemoral ligament, and the active opposing forces are iliopsoas. At knee joint, the joint line of gravity lies anteriorly. The external movement is extension. The passive opposing forces are iliofemoral ligament, and the active opposing forces are hamstrings and gastrocnemius. At the ankle joint, the joint line of gravity lies anteriorly. The external movement is dorsiflexion, and the active opposing forces are soleus and gastrocnemius. So, when we talk about the alignment in the coronal plane, at the head, the LOG passes through middle of the forehead and nose and chin. The chest, it passes through the midline of xiphoid process. The abdomen, it passes through the umbilical or the navel level. If we see further, at the hip, it passes on a line equidistant from the right and left anterior superior iliac spine. At the knees, it passes between knees equidistant from the femoral condyles. And at the ankle, it passes between the ankles equidistant from the malleoli. So, when we talk about posterior alignment of the gravity, line of gravity in coronal plane, at the head, it passes through middle of the head. Shoulder passes along vertebral column in a straight line, which should bisect the back into two symmetrical halves. Then we see at the hip passes through gluteal cleft of the buttocks and should be equidistant from the posterior superior iliac spines. Knees passes between the knees equidistant from the medial joint aspects, and at the ankle passes between the ankles equidistant from the medial malleoli. Now, this pattern of posture, we could have two patterns. Either our posture could be good or our posture could be poor. It depends on how good, finely we are carrying our body. The attitude at which we are carrying our body, how fine that is. So, good posture is when it fulfills the purpose with maximum efficiency and minimum effort. These are the two basic components of good posture: maximum efficiency and minimum effort. If the erect posture can be maintained with minimum of muscular effort, then we could call it as good posture. Poor posture is when it fails to serve the purpose for which it was designed. That means when we are having more effort and the efficiency is less. Here we could see some examples for poor posture like lordosis, exaggerated lordosis, sway back deformity, exaggerated kyphosis, scoliosis. So there could be some possible effects of malalignment. We will see the deviations. Here we could see excessive anterior tilting of the pelvis. It is mainly seen if there is shortening of iliopsoas or lumbar extensors. We could see excessive lumbar lordosis. It is mainly seen when there is posterior longitudinal ligament shortening, interspinous ligaments shortening, lumbar extensors shortening, or if there is overstretching of anterior longitudinal ligaments. Then we could see excessive dorsal kyphosis when there is shortening of anterior longitudinal ligaments, upper abdominal muscles, anterior shoulder girdle muscles, and slacking of dorsal back extensors or scapular muscles. We could see excessive cervical lordosis with shortening of posterior ligaments, neck extensors, or slacking of anterior longitudinal ligaments. Then we could see forward head posture. Forward head posture, the structural components involved will be anterior location of LOG, which causes an increase in the flexion movement, which requires constant isometric muscle tension to support the head. So this will stretch the suprahyoid muscles and pull the mandible posteriorly. So what will be the long-term effects? There will be pain, fatigue, protrusion of the head forward. There will be protrusion of nucleus pulposus, retruded mandible positions, and reduction in the range of motion along with pain. There we could see increase in cervical lordosis. Here we see narrowing of the intervertebral foramen and compression of the nerve roots. There could be compression of posterior annulus fibrosus, zygophyseal joints. There will be shortening of the posterior ligaments. There will be lengthening of the anterior ligaments. There will be increase in the compression of the posterior vertebral bodies. This may lead to damage to spinal cord, damage to cartilage. There will be change in the collagen and early disc degeneration could be seen, which will lead to osteophyte formation and early degenerative changes. We could also see decrease in the cervical extension, range of motions, and stability of the cervical level. Then we could see medial rotation of the scapula. This could be along with adaptive lengthening of upper posterior back muscles, adaptive shortening of the anterior shoulder muscles. This will lead to increase in dorsal kyphosis and loss of height. We could also see decrease in the vital capacity and range of motion of the shoulders. Now let us discuss about the factors which affect posture. There are mainly, and even if they are known, are very much factors which play a very important role in altering the posture. First is the mental attitude of the patient. Second, the poor hygienic condition, prolonged illness, reduced efficiency of nervous system, localized pains, recurrent localized pains, and muscular weakness. Occupational stresses, muscular disbalance, faulty posture, sedentary lifestyle, some structural pathologies like it could have change in the pelvic angles, some hemivertebra, laxity of the ligaments, or sometimes fashion also plays a very important role in altered posture. So causes of poor posture could be postural, structural, and mental attitude. These are mainly postural is when there is the basic cause is underlying muscles which are getting due to some particular posture which are getting affected. Structural is underlying osteoligamentous structures are getting affected, and mental is the attitude what patient feels. Postural factors could be poor postural habits, not wanting to appear taller than other peers, so they will try to tend to lean forward. Positional factors could be pain. If there is pain on one side, patient tends to lean down or lean on the other side. Some respiratory conditions, underlying conditions like emphysema, due to which the patient will develop a particular kyphotic posture, or sometimes excessive body weight could also be very important factor in changing the posture. Structural factors could be congenital abnormalities, developmental abnormalities, any trauma. If there is a limb length discrepancy, that could lead to postural changes, or there are muscle imbalance and muscle contractures that could also lead to postural imbalances. Then mental attitude always leads to a slouch posture like unhappiness, tension, depression, stress, feeling inferior, which you could say inferiority complex, always feeling low. These things could also play an important role. So, this is about the posture. If anyone wants to ask anything, if anyone has any query, you can call me, WhatsApp me, or email me. All the queries will be answered. In the next class, we will discuss about the analysis of the posture. What are the different methods to analyze the posture? Till then, thank you. Have a great day. Stay safe.